It's
Yeah.
really hard to know. And I think we have struggled to even get a good sense of what we think would happen absent intervention, in the sense that, we saw early on in the pandemic, of course, there was fear about what was going on in the city. It was a struggle for a lot of these migrants to even get home. Then they got home. Of course, what we know, especially for female migrants, what we know about the household heads, perceptions of the big bad
Mm-hmm.
city, and it's crime, and it's corrupting forces and so on, gets amplified then when, well, now the city is also the epicenter of this
Yeah.
health crisis and so on. And so early on we saw a lot of that. There's no real expectation. We asked about expectations to now send someone from your household to migrate again, and we saw suppression of that. Later on, though, you get the countervailing force, right? Which is that, but there's no work here.
Yes, exactly.
We've all lost income for months and months, and now going on a year. Now, what do we do? So even though this might have amplified our worst perceptions of the city, there is a demand for work and to get reintegrated.
Yeah.
But that's right. It's hard to know whether there's support that needs to be provided, or information campaigns, or endorsement of particular types of employers that they know are doing good practices, and so on and so
Yeah.
forth. Pay for the work.
So one thing the government is doing or trying to do is, this linkage in terms of labor and employers, right? So basically, that's something actually that we are working on a little bit. And again, the process literacy issue is huge in the sense that people don't, I mean, there are jobs available, but people don't know how to get them and how to access them and what kind of paperwork is required. And, they just kind of fall off because of that lack of awareness.
Yeah,
So
and I
yeah.
think the other way is difficult too. So that if you could get the right information about those jobs out, and you could to the people broadly enough so that people could self-select in, you'd have a much more efficient system. But if you
Mm-hmm.
have all these obstacles to self-selecting in, then it's kind of the onus is on the employers to go out somehow and find the workers who are
Mm-hmm.
interested. But if you go drop a pin in the middle of some rural area, in percentage terms, how many of those workers want to come, or how many households. One thing we're realizing, we're working with the government on the DDU, on an evaluation of the DDU GKY scheme for skilling scheme for garments. And what's interesting about that is that there's lots of resources for skilling. There's lots of support to have employers, ultimate employers, or maybe third parties in the middle, but run these centers, recruit, train,
Mm-hmm.
place. There's plenty of demand for
Mm-hmm.
this labor in the city. But when you actually get into the nuts and bolts of running this, it's really hard to get the volume, because, yes, is it true that in absolute terms, there's a lot of people,
Need.
potential migrants looking for interest? Yes. Looking for jobs? Yes. But if you go out to just any village cluster, any Thalagor, and try to then do a census, you'll spend a whole bunch of time trying to mobilize to get,
Yeah.
one person, 3 people, 5 people. And it's a very inefficient process. Whereas exactly, if the information systems were a lot better, and then the kind of the ability to self-select in and enroll and so on were that was all
Mm-hmm.
streamlined, it would be a much more efficient system.
Yeah, there's
Um,
definitely room for targeting here. And, I think we we could do something here in terms of understanding like where are these individuals, right? And kind of get that information to them, so that they can, as you're saying, then select in. But currently, I don't think, I mean, there's a long way to go there.
yeah,
One piece is that there's also a lot of misinformation, because specifically in the context of COVID, there was a lot of stigma around migrants. So, for example, early in the lockdown, 50% of households from our surveys were saying they didn't want migrants to come back. And then another 25% for saying that they, said that, okay, if they come back, they must quarantine, etc. So, large numbers were kind of wary of, migrants coming back.
Yeah, I think that's right. We actually had a small study that we did around this kind of information bit. Number one, showing that indeed there was a lot of misinformation, but it was like active misinformation in the sense that it wasn't that there was a vacuum. Oh, they didn't know much about what was going on. And so then their kind of imaginations ran wild. No, rather there was actually a lot of spread of gossip and rumors and all these types of things via WhatsApp channels and so on and so forth. And so the anxiety was rightfully high, but kind of irrationally high when it came to certain types of things just because of misinformation. We ran a campaign where we tried to just spread like factual information about how is it spread, how is it treated, what are the current numbers of cases and so on and so forth. Yeah. And what we found was that even when it comes to that sort of thing, it's a small, interesting study, but just that the medium of information really matters. A text message doesn't really help that much. Even a voice recorded phone call is not nearly as impactful as a live phone call, reading the exact same script. And they were just little things like the person was engaging, would, number one, of course, listen to more of the message if there was a live person on the phone, which I thought was interesting. They just got further through the script than with the voice recorded call. But also they would ask, also they would engage in the sense that they would ask it to be repeated. Oh no, and they would ask questions about the information, all these kinds of things. And so then what we found was that their measured anxiety about COVID actually was affected by that. So the impacts on providing information on this kind of anxiety level really depended on how the messaging was done. I'm sorry.
Absolutely. No, I was going to kind of reiterate is that for the phone surveys, we've done quite a lot of experimentation to understand, response rates and also just getting people to answer the phone and then to complete a whole survey. And for example, one insight is that having female surveyors makes a big difference to get women in particular. And then basically if it's a man, then they ask more questions, they're more cautious. The time of day makes a big difference in terms of, again, if you're calling in the middle of the day and the woman is, busy, she's not going to be able to come and answer the phone as compared to in the evening. And similarly, being persistent has helped. So, calling many times, we've done experiments on this. Really makes a big difference.
I think we've had a similar experience when it comes to, were you using the kind of computer assisted technologies for that? Do you feel like there's innovation there? There's need for improvements there? I mean, how difficult has this survey been to run? Any other kind of trials and tribulations about trying to run this?
No, so we have this, data on demand service that we provide, where we have an infrastructure where we have about 1,000 surveyors who we manage and then train. And we've really been working a lot on data quality in particular. So, understanding things like this is, how to get people on the phone, how to get them to stay on the phone, what time to call. We've just been doing so much of this. As I said, we've done 5,000 households for 6 rounds just for the COVID surveys. So we've, it is really a machinery that we've got in place, and it's on demand in the sense that, we use those same surveyors. So they have been trained, there's a relationship with them. We know their quality, we're able to provide them feedback. So from that perspective, that's something that we've really strengthened over this period also.
That sounds quite unique. I mean, sorry, go ahead. Yeah.
No, sorry, go ahead. I just said, social and behavior change communication is something that we've been working quite a bit on. And in terms of the mode, what we found, we've been working with the National Nutrition Mission. What we found is interpersonal communication is really, the key. And, the frontline workers and getting people who you trust to talk to you is often the key to actually believing what they say, at least, and maybe understanding what they say. In terms of behavior change, that takes more, but as compared to
messaging,
that personalization makes a big difference.
And that's an important insight. Of course, it's a challenge. It provides a challenge because when you're trying to then do this type of work at scale, so often we want to rely on technology. We want to think about, but of course, practitioners like ourselves across contexts have seen that, well, these text message reminders, they can be impactful, but most often they're pretty minimally impactful, or there's never really as much impact as we would like. When we use these kind of personal networks, impacts are much larger. It's a costly thing to kind of leverage, and it's a little bit hard to think about how to do that at scale.
Yeah, and specifically in the context of COVID, right? Like doing interpersonal communication was impossible. So you did have to get, WhatsApp groups. And in fact, that's been really interesting, is seeing the use of WhatsApp groups officially, being used across India for various purposes. So and SMS messages, etc.
Yeah, I think that's right. I just wanted to go back to your data on demand efforts for a minute. That sounds like a really unique offering you've got. Is it something that you're seeing a lot of demand for? Are you seeing other groups do similar things? Because I haven't heard as much about this type of thing.
Yeah, no, we are really excited about it. And, we've been building it out. We've used it mostly for government currently, because, the theory is that it could support performance-based management in a way, in the sense that if the government is able to collect data regularly from households or from service providers, then they can keep a pulse on what's happening and then respond depending on the kind of information that they're getting. So that has been really useful, and we've provided this to the Niti Aayog for the Aspirational Districts program, but we also now kind of using it for other purposes, and we're definitely experimenting in terms of maybe for basically there are lots of ideas, and one of the ones would be to directly kind of get feedback from citizens. So yeah.
And so, whether it's the work that's coming through the data on demand system, whether it's this just this particular large scale survey this panel survey you did for for COVID, how have you made some of these different types of data available? I know that ID Insight does kind of these integrated data portals before for different things. How have you seen those used, and how important do you think that is to kind of have these data portals up?
Yeah, that's a great question. So, even internally, these data portals have been really useful. So starting, for example, with the data on demand team, we regularly use dashboards to get a sense real time in terms of the quality of the data that's coming in, so that we can provide feedback to the surveyors or clusters of people on the item level response, etc. Certain questions are problematic, so we're able to do that. And then for government, ID Insight was working with the Delhi government, and we were working specifically for their patient management system for coronavirus cases. And we supported the government in building the COVID dashboard. And the nice thing was that we also, it was very much working with the government to kind of pull together, a range of kind of disparate Google files, and then understand how to connect them and make sure that, there was no patient getting kind of left behind, and that there was granular information in terms of areas where, there's more cases, etc. And we're still being able to produce those reports to get a sense of like bed occupancy rates and all of that. And it was really like, at the height of the pandemic, there was a team embedded with the government, as they describe it, like building a plane as it was being flown. So it was very intense and but very rewarding also. And now the good thing is the government is running it, so it's been completely handed off to them.
That's great. And I think there's probably a lot of learnings that come from something like that, in the sense that, we just talked at length about the difficulty in identifying migrants, individuals, when it comes to whether it's a relief distribution or public goods distribution, whether it's data collection, whether there's, whether we're talking about these data collection efforts, we're talking about these kind of individual identification when it comes to relief distribution or public goods distribution, or whether it's even the kind of in the height of the pandemic, what you're talking about, like tracking individuals and cases and their kind of progress and so on. The same challenges kind of occur when we think about migrants, which is that you need to identify individuals, you need to be able to kind of track them across systems and points and so on, and that's information that just doesn't exist right now. Could be very powerful, but maybe we could potentially use similar techniques in some sense. So like you said, it's that you had the power of knowing the origin, so you've got the household's identity there. Potentially we have some phone number for them, we've got their employer. So do you see a way that maybe this kind of what you've learned from the Delhi Fights Corona kind of exercise could be used to maybe track migrants? Or
yeah, so I'm a little bit skeptical about doing this, and curious to know if you know of good use cases in terms of tracking migrants, just because I think the goal really for migrants from a policy perspective should be to free them and, to be able to, for example, use the same ID across the country, and basically, not have to kind of tie them down in bureaucracy. So from that perspective, like I would be worried about setting up a system where they have to kind of register or, kind of more paperwork or more literacy required of a new process. But if there is some kind of like, light touch approach, I would be curious to hear what it is, because, we know, for example, that there's so many IDs being talked about in India currently. And I would worry about like one more
yeah, absolutely. Yeah. I totally agree with that. I think what I'd hope is something more like leveraging existing systems as opposed to creating a new ID, connecting. I mean, I think the bigger problem is tracking migrants across state, even for the purposes of just getting access to resources, has been a bigger challenge. But even more so in some sense for, let's say for organizations like ours or yours, to even just understand what the experience is or what the set of problems that need to be worked on, it's hard. We really don't even know reverse migration rates that well. We don't know, continued employment rates that well. We don't really know. We have this sense that if you get trained and you get linked up to a good quality job, that should be freeing. But then oftentimes those workers are with that job for 3 to 6 months, maybe maximum. And then we actually don't know whether, did they give up on the migrant experience altogether and go back home? Did they go on to another job, but it was actually a good job, and therefore, is it a win or a loss? We don't really have a good sense.
No, I completely agree that, that information is lacking and very important. And I feel like the way to go about that is, these like official surveys that need to be done, like the census or the NSSOs and, those kind of pulse checks on what's happening in the country. I think that's really useful and important. And of course, making it available to everybody to use. Yeah.
And like you said, then if we can do that at the household level, oftentimes the household is the best way to find out where everyone is.
Yeah, they can provide their history and, their antecedents. So I feel like that's probably the best way, but given constraints, I think we kind of trying to figure out other ways.
Yeah.